So here in the UK, birth centres are the default setting for women who've had a straightforward pregnancy. Usually the birth centres are attached to the hospital where you'll be having your baby. They may even be on the same floor as a delivery suite or labour ward, or they may be on a different floor. We do have some freestanding birth centres here in the UK, but on the whole they're attached to the unit where you'll be having your baby. They're run by midwives who are experts in physiological birth, and they tend to have more of a home from home feeling maybe than the labour ward. They're sometimes called home from home or midwife-led units, or birth centres, same thing, just different name for it. And the rooms tend to be a bit more homely looking. They might have, for example, a double bed, which sometimes can be pushed up against a wall because they want the woman to be active and moving around, but she can use that if she wants to. They may have like a little sofa that she can sit on, or her partner can kind of, relax on or get some rest on in between surgeries or what have you. They have lots of equipment, so they might have things like birthing balls, which are available on the labour ward as well, by the way. And like, it may have big mats on the floor, so the woman can like make a little nest on the floor. They may have birthing stools, ropes that they can kind of hang on to get like a supported squat. So there's kind of lots of equipment there, a bit more room available as well. They're going to have an ensuite, just like most labour ward would have an ensuite as well, so shower and or bath or toilet. And they are, what else can I say? Some have pools in them as well, or inflatable pools. Not all of them, but some do. If the woman needs to be monitored more closely, or if she decides she wants to have an epidural, she may change her mind. She can then leave the birth centre and go to the labour ward and get that set up. It might not be immediate for the epidural. If she needs to be more closely monitored, maybe for health reasons for her baby or for her, again, any extra monitoring will take place on the labour ward. So the standard monitoring will still happen in the birth centre, just as it would for any other birth. So listening in every 15 minutes for the first stage of labour, and after every contraction, after every surge for the second stage, so that the monitoring is exactly the same as it would be on the labour ward, birth centre or home birth, unless of course a woman needed extra monitoring, electric fetal monitoring.